Hello, everyone. Thank you so much for joining us live today on Facebook for another one of our weekly skincare talks with our MDPen educators. We're going to be talking today about microneedling, tricky areas on the face. So learning some tips and techniques for microneedling those hard to reach areas of the face, all the non-flat or sort of sensitive or special areas that we just want to attend to. And to join me today on the call, we've got Nadine Soni, one of our MDPen educators. Nadine has been educating for us for some time now. Nadine, why don't you introduce yourself?
I'm Nadine. I've been, I believe it's been 3 years that I've been with you as an educator, and my 13th year as an esthetician. And I came to being an educator after bringing the microneedling into practice and really enjoying it. So.
Awesome. And I'm Carmen Simons. I'm on the marketing team here at MDPen, and I enjoy working with Nadine and all of our educators as we try to help our practices not only perfect their technique, but also we want to help you market your practice. So that's part of what I do here at MDPen. So let's talk about what are some of those tricky areas, Nadine.
So when we're doing the face, I feel like the face is by far the most common requested area. When people start learning about microneedling more, they'll extend to different parts of the body, which is wonderful. The tricky places, though, in the face, we don't want to overlook, be unsure, or be doing it wrong. So today we're going to be talking about the eyes, the nose, and on the actual lips and around the mouth.
Awesome.
And so why are we microneedling? This is super important to understand. The concept of microneedling is to generate new collagen and elastin. So it's wonderful for the lips. We're really plumping the lips. We're going to spark the body's natural healing process. And we're also going to create microchannels to the skin so our hydrating serums can be absorbed, infusing the skin with the hyaluronic acid. So let's start on how to treat the face. Always cleanse the area first. I can't say this enough. People come in, they have their SPF on, or they have their light moisturizer, they say they don't have anything going on with their skin, and you're taking a picture and their skin's not prepared. So you always want to make sure you're using our MDPen cleanser. It's not going to aggravate the skin. Get a nice cleanse, and then take your picture. Our first step after that is going to be numbing the skin. Remember, this is only with the Restore needle. It's the more commonly used needle, but we're going to make sure that we numb unless we're doing the Refine. Remember to put the numbing cream over the lips if we're adding the lips into the service. So the numbing cream, the protocol is 20 to 30 minutes. I like to be on the safe side and leave it for 30 minutes. We're going to use our cleanser to remove the numbing cream. Before doing that, sometimes I like to get a 4x4 and get a good wipe of the buildup of the numbing cream, and then go into doing a nice cleanse. And then we're going to follow that with alcohol. That's going to kind of degrease the area, make sure you've got everything off. This can also be done with witch hazel. So if you have a client that's sensitive to alcohol or underneath the nose area, witch hazel is also okay. And then we're going to rinse that area with the distilled water. So what I like about our pen is that we're able to adjust the speed and the depth. And when we're working around the eyes and mouth area, that's something that's going to go at a lower speed. So this is super important. So you want to calibrate your pen. And then after calibrating your pen on the high speed of the speed of high and 0, the depth of 0, then you're going to go into picking your settings.
Yes, and we'll talk a little bit more about settings. I know that's always really an interesting question people want to ask about how deep or how fast. And we'll be talking a little bit more about settings when we talk about each area.
All right. So during the treatment, we're going to apply the MDPen serums that are formulated specifically for the microneedling. This isn't going to cause any aggravation. So our very first product that we want to use is the hyaluronic serum. The reason for this, besides hydrating the skin, infusing your skin with the hyaluronic acid, if your pen doesn't have a slip, you're going to feel it. You're going to feel that tug. So you just want to have a nice thin layer of the hyaluronic acid on your skin, and so that will be our first step. So what I like to do is I like to put my hyaluronic acid into a cup. That way I'm not going back and forth touching the bottle. I can double dip. A nice guide for when you're pumping your serum into the cup is 7 pumps. You might get someone that has a smaller face, a bigger face, but we have 7 sections of the face. And so as a rule, it's very easy to overuse this product. It's not needed for the pen. It's not needed for the skin. As estheticians and practitioners, we just want to keep nourishing. 7 pumps should be just fine, though.
That's a great tip.
Yeah. And so here, this is considered the very first section is the forehead. See how I'm only doing half of the forehead? And so we've got 7 sections of the face. That would be the first section where we're going to apply the hyaluronic acid. If you put it over the whole face, just a side note, your skin's going to drink it all. You're going to end up reapplying it.
Right.
So
it's better to
do it as we go.
Do it as
right.
we go, yeah.
Okay. So we're going to, for these tricky areas, we're going to incorporate the straight tracing. And then also we're going to be doing the stamping, which the stamping you'll hold down for, hold your pen down for a full second, and for the straight tracing, you're going to be moving 1 inch per second. So with this, after you've done your straight tracing, you can do that up to 3 times, depending on your client's skin. And as for the stamping, the same thing. With the stamping, just make sure that you are holding it still, leaving it for a full second, and then lifting the pen up. Not so much putting pressure as a stamp, but just kind of touch and lift.
That's a great note about pressure. It's really important not to apply too much pressure either with the tracing or with the stamping.
Correct, yes. And so here we have our first tricky area, which is the nose. So with the nose, we get a little bit of a tickle. It doesn't hurt, but there's a little bit of a vibration, the tickle through the nostrils. And so you just want to hold the skin taut, and where you can see here, I'm holding her nostril closed. It's better to be a little bit firm with how you hold the client's skin and be consistent with your pen, not put that pressure on your pen. It's not going to hurt the client to hold their nostril closed. You don't get that tickle, you don't get that discomfort. You can do this 3 times as we talked about, and the depth would be 0.5 to 1. So I think with a lot of clients, 0.5 is a very good beginning gauge. If someone's got thick skin or a lot of scarring and they've got more problems on their nose, then I would go to a 1. And then the speed for this, just like most of the face, is going to be medium speed.
Okay.
And so here, the tricky area that we have is the eyes. And I'm excited to talk about this because I think that it's one of most people's main concerns. And so we don't really want to be reserved on treating an area that is very commonly have the fine lines.
Right.
The catch to this is you just have to be careful. No matter who you are working on, the speed is always going to be low. We're not trying to rip the skin. We just want to be able to treat the skin.
Right.
So you're going to go at a depth of 0.25. This is not going to vary. So if you look at our charts and we talk about other areas, we've got a range: thin skin, thick skin. How does their skin respond? With this, it's very simple. So even though it might be an area you're unsure about, the protocol is actually more direct. You're going to go low speed with a 0.25 depth, and you're going to make sure that you keep your pen connected. So we know this for the whole face, but it's simple with the rest of the face. With when we're going over bends, it's easy to flick your pen off, and even though you think you're flickering away and it doesn't hurt, it feels uncomfortable and you're not treating the skin. So I like to use my hand as a strong anchor and just keep the pen connected and go outward away from the eye. This is super important because then there's no space for error with hurting them, sliding. If they move, always outward. With so you're just going to kind of scoop the pen away outward. You can get the skin that is super close to underneath the eye. You just need to pull it down and trace.
Great.
And this can be done below the eyebrow,
Mm-hmm.
you know, around the whole eye area.
We did see a little in the video of tracing right over
Yeah.
the eyebrow. Oh, let me see it again. So there's another look at how that tracing goes over directly over the brow.
And see how I'm holding her head pretty steady, and that's okay. That, you know, it's also okay if you need to move the client. You don't need to be bending. I see sometimes people trying to bend to accommodate the client, and before you know, you're doing like a twisted service,
Right,
you know.
right.
And so it's important to be able to move the client's head if you need to. How you feel comfortable with this area.
Okay, so let's move on.
And then the last area that's tricky, and sometimes people are skipping just because they're unsure about it, is the lips. This is something that can totally be treated. The only thing is that you just need to make sure that you numb them when you numb the rest of their face.
Right.
And then this one, you can go outward, and you can also go down if you need a couple more passes with the lips. What I'm doing here in this video, you can also do on top of the lip, going upward and then downward, and you're going to split the lip into 4. So you've got, you know, your two halves on the top, 2 halves on the bottom. So not going straight across. And then with the lips, you know, you're going to have that movement. So again, hold them taut, and this is really great for plumping. With this, kind of remember your lips and your eyes are in their same category in the fact that they're at a low speed. We're not trying to rip someone's lips apart. We want to give them a nice plump, and it's something that the lips respond really quickly, which is wonderful.
Right.
So let's just do this at a low speed with the depth of 0.25, and if you want to, you can go up to 0.5.
This is a great treatment for someone who's got the smoker's lines, perhaps.
Smoker's lines, dry skin. I think a lot of people age around their mouth. Just making this, it's almost like an exfoliation. So, you know, you're not getting those cracked or dry, just resurfacing the skin on the lips, and then also giving it that plumpness.
That's a great trick to get your lips to look even better under your lipstick and things like that.
Absolutely. And we have too, we don't ever really talk about it, but we have our chapsticks too that are really nice after this. So, you know, you can let your skin breathe for, you know, a couple hours after the treatment, and then, you know, you can put your chapsticks on, but you'll just feel a difference. Yeah.
Yeah, that's true. We don't talk a lot about the chapstick. We have a really great organic chapstick that would be great after treatment like this.
Yeah. And so here's just a picture of the skin. I like to show clients pictures like this beforehand just so they know what to expect. You've just gone across their skin with needles, so you're going to get the erythema. What we don't want is pinpoint bleeding. When we start getting the pinpoint bleeding, you know, obviously they've signed off the non-blood thinners, but if we're getting more like bleeding than pinpoint, then we need to lower the setting. So here we are with a protocol. If you see this skin is responding in a more sensitive way, you can always go lower. But the guidelines of what we have is where you're going to see those nice results. But it's not like the higher the better. Does someone have thin skin? Does someone have thick skin? Remember, when you're working around the eyes and the mouth, it's always going to be a low speed. So I think it's important to remember. So this is just afterwards how the skin will look.
And I think it's great to point out from a professional like you to help other people and clients and professionals realize that it doesn't have to be a bloody seam like you see a lot in the videos online. That doesn't necessarily mean you're getting a better or more effective treatment, right?
Right, and I think when people are looking online too, they don't know what they're looking at. So here you are, you see blood all over the face.
Right.
That blood's not from the microneedling. We've done the microneedling with a pinpoint, with pinpoint bleeding, and then we've applied the PRP, which is wonderful. So we're seeing, you know, blood and seeing that shine on someone's skin afterwards.
Yeah.
So we're not accurately seeing, you know.
In some cases, I guess it is PRP, but in some cases, it's really over-treatment. We see a lot of it.
Yeah, when you see people doing circles with the pen, we're not trying to aggravate the skin. The nice thing about the pen is when you set it to the depth and the speed that it needs, and stick with that inch per second technique, there's no space for error. We're not ripping the skin apart. We're not running across the skin. We're letting the needle do its work. and the results are very consistent and nice. You know, when
Right.
we're doing circles, we're not trying to beat your skin up, because then it's not a micro injury. We've actually injured your skin and you're trying to heal, you know.
Right, exactly.
We don't want to cause any, you know, any
That's
problems with that.
That's a great point to put it.
And so after the treatment, we always want to apply the copper mist. This is great for inflammation. The other thing that's nice about the mist, as it says, is it's a spray. So we're not rubbing the skin, we're not aggravating the skin. This can just be misted across the face. I always tell people during trainings, mist it confidently. It's kind of like when you're spraying your perfume and it squirts out, you know, kind of weak. Just do a nice, confident one mist across the face, and they're good to go. Now, to complement this, we can put the human growth factor on, and that can be the final part of your treatment. This could be used as an add-on, or it could be something you could have included in your service, but this is really, really going to hydrate your skin, and it's going to promote the healing. It's going to be a lot quicker healing, and you can feel that soothing. The texture of it, you can tell in this picture, is a little bit thicker, so it just feels really, really soothing, protecting the skin.
Yeah, I love that product.
So for the people out there that aren't doing the PRP, this is my go-to. Just if you're not doing the PRP, then you need to be doing this.
You need to be doing growth factors, that's right.
And then you want to send your clients home with the correct products. This isn't something that they have to use for the whole month. They can use it from the whole month. It's got a lot of benefits, but for the first 3 to 5 days, if they are using something else, it's not that their product is bad, but it could cause problems to the skin. This is stuff that's going to complement the service you've done, protect their skin, and help their skin heal properly. The cleanser, we've got the calendula in it. It's going to foam nice. It does not have acids in it where you're going to aggravate a wound. The serum, you're going to get that nice hydration. The serum, I always think of it as like a food for the skin. So you're feeding the skin. You've got nice moisture, almost like a moisturizer and a serum in one. The mist, again, you're going to have that nice calming, stopping the inflammation. And then the growth factor, I recommend when they take this home for them to sleep in it. So protocol, 15 minutes, but why not sleep in it? It feels great, and you're going to your skin's going to recover quicker.
Yes, it's a great nighttime treatment.
Yeah.
Well, thanks so much, you guys. We've made to the end of our presentation. If you want to learn more about MDPen MicroNeedling or any of our serums, you know, you can visit our website, mdpen.co/schedule, and there'll be an opportunity there for you to schedule a call with us. We'll have a professional, one of our specialists, to contact you to answer any questions you have about our products and services, and talk to you about how to bring it into your practice. And if you mentioned that you saw this class today, you can receive up to $600 off the cost of your device, which is a great savings. And it's a savings that we like to offer whenever we do any kind of training. So you can call us at 888-313-1415 or visit the website. And check us out next week. We'll be back with another class. Thanks so much for joining.